Hi, this video is on a client who flew all the way from Canada for hair restoration. He's thinning from the front all the way toward the back, and so, and we would be harvesting at least 4,500 grafts, and we built the front half up to 3,500 grafts or more, and then the rest half we just scattered toward the back. He has existing hair, but his vellus hair is half the diameter of the donor hair in the back, and then it grow pretty slow, and his hairline has gone up quite a bit. Hair transplant require more than just the surgical skill of the surgeon. The surgical skill, as you know, it dictates the density, how dense your hair. The artistic and aesthetic detail is very important, and that's what separates from one clinic to another, how to have a very natural hairline. Because it's not like the old days where you just be happy just to have hair. And some analysts realize you have mature hairline, but some of them they did the hairline around half of the head, and so you still have a huge forehead. It makes no sense. On average, from the mid eyebrow to the hairline for Asian is around 6.5 to 7, for like black African American as well. For the mid eyebrow to the hairline for Caucasian is around 7.5 to 8.5. This client actually around 6 centimeter. Again, it's all depend on an individual. No one gonna be exact the same, and so as long as proportional to overall the face, from the mid eyebrow to the hairline is a third, mid glabella to tip of the nose a third, tip of the nose to bottom chin is a third. And then once we get the shape, or we got the height down, we the more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. His forehead's a little bit wide, so we bring in the temple a little bit. Maybe you can turn this way for me. There we go. And turn here. It's very subtle for him. And again, from the midpoint to the side, so around 7 to 8.5 to 9 centimeter. Actually, his is a little bit smaller, and he's not, not a 6'5" guy. He's just a little bit smaller guy. And so again, we want to make sure proportional to overall of his face. And then he want a mini widow's peak, so we can do that. Once you get that shape down, we zigzag the hairline. There's no hairline straight. So the line is an imaginary line. There's really no line. And once we get the shape down, we will transplant a very precise angle of 35-45 in the front. It increases when you go backward and changes when you go different direction. And then selection of hair grafts is important. We transplant rows and rows, single hair graft in the front, followed by root growth 2 hair, 3 hair, and 4 hair in the back for bulk and volume. The goal in the front is softness and naturalness. You don't want any harsh, thick root in the front. And the goal in the back for volume and density, and that's very important. And you want to dense pack as much as you can, but there's a certain way you dense pack them, because you don't want to do too close where it doesn't grow, yet you don't want to do too far apart where it looks too sparse. So there's the precise science behind this as well, not just the taking the hair and all the stuff. I'm very excited for him because his forehead's gonna be a little bit smaller, but once you have a lower hairline, full set of hair, it really frames the face, and then it will enhance his eyes, his nose, and all the features that God created for him. I know it's tough for him to fly out of his country from Canada, but down here, but we're gonna make it worthwhile for him to give him the best result, and we will do at least 4,500, and he's very thin toward the back as well. So we just dense pack as much as we could. Thank you.